So welcome to day 2 of our 7-day spinal mobility routine. We are going to focus today on more of our SI joint, which is the lower part of our spine into the pelvis, which is our most commonly affected area with AS, but also our psoriatic patients can still have pain there. So follow along, catch you in a mo. Okay, here we go. So we're going to start with our neck just to quickly move through our spine and get to the area we're focusing on today. So again, super simple. We're going to move our neck. We'll start in our flexion and extension. Again, every day we're not pushing, we're flossing. Push towards the end range. We're going to go left into right. Now some of you, I expect most of you, will have one side that's a bit stiffer. What I don't want to see is this, yanking your head, giving it a push. I just want gentle movement. And if you're a little bit stuck in one way, come away from it, go back towards it. We're trying to push that movement. Okay, next up, we'll do a combined movement. So we're going to tilt our head, look down to the floor, up to the ceiling, back to the middle. Tilt our head, down to the floor, up to the ceiling, back to the middle. Let's go again. Now something we don't do a lot of is extension and flexion of our spine. We do a lot of bending down. We don't do a lot of going back. So hands on your chin, you're going to push your head backwards. I call it the pigeon. And for some reason, using your hands really helps. Think about your head being pulled on a string, back, forward, back, forward. Beautiful. Next up, we're going to look at our T-spine. So we're going to take our hands, wrap around your neck to the bumpy bit on the neck, and all we're going to do is try lean up and down. Very subtle movement. Up and down. This is also really nice with your back into the chair, but I'm just trying to show you how it looks. Why am I doing this? Well, hands behind your neck blocks your spine, your upper spine, your neck from moving. So we get more of the movement through what we call the thoracic, our upper T-spine. And for some of the women in our group, they'll know that this is one of the stiffest places in their body. Also, in modern day, we live on our computer screens and we live laptop culture. Well, this is the area kind of above that bra line, T6, that gets super stiff. So this is one I'd encourage you to do throughout the day. Okay, we're going to go into more of our lumbar spine. We're going to jump straight down. So again, we're going to flex down and then up. I'm excited to get to the SIJ because this area that we're about to hit is the most common area of inflammation of our populations. So again, as yesterday, what we're going to do is breathe out. Breathe out when we come down. Breathe in when we come up. Beautiful. Now you'll see on days that we are focusing on something or one part of the spine, I'll do a lot more combined movements. So this is what we call a combined movement. Now you're going to lean down. You're going to take your hands on your head, or you can just hold them here, and you're going to try and rotate, and then back to the middle and to the left. What this is doing is combining a load of movements. Not to be too boring and physio-like, but we're combining side flexion, a little bit of rotation, and our flexion. Really good. Beautiful. Awesome. And then the last one before we get onto the SI joint, take our right hand, slide down your left leg. And back up, and then swap. Good. Beautiful. Thinking about our day coming up, work, kids, life. Busy. I got 2 under 2 at the moment. Life is busy. Right, we're gonna stand. So the only thing you'll need, you can move your chair out the way. Is something to sit on. I've got my 80s look in this house. So we've got our poofy, as we call it. We're gonna focus on, again, now getting into the SI joint, okay? So I'm gonna take my leg, whichever side, you place it on something raised. This can be a book, this can be anything. The higher, the better, but don't force that hip. And what you're about to do, I wanna pop your hands on the back of your hips so you feel that SI joint, which is around there. And all you're gonna do is slowly lean down and then back up. It's a very subtle movement. What we're actually doing is moving that SI joint backwards and forwards like this. We call it a glide. We're gliding. Awesome. It's not a back arch, it's very much a chest coming forward. So what's nice about this is we're really focusing on one side. So again, I'll show you from the back. This is my SI joint. We're here. I'm gonna lean down and back up. You should feel this area moving a little bit and then back up. Coming down, back up. Beautiful. And it's not a forced movement. It's a calm movement. It's a slide and a glide. Ideally, what we're doing is pushing any inflammation at this area out of the joint. We're warming it up. Okay, beautiful. We're going to keep this here. The next movement is the gap. Okay, so we've got 2 more movements to do and we're done. So we're going to raise our leg onto something raised. Now again, it can be half the size of this. I don't mind. So leg raised, we're going to lean over a little bit and with our hands, start at your kind of hip and then I want you to lean down. 2, 3 and hold at the end and then slide back up. Again, I don't have AS. This is going to look a lot easier for me than other people. I don't mind if you get into this position and you move a couple of inches up and down. I don't care. You're moving it. And in fact, what you're really doing is quite cool. You're gapping it. When my leg is here and I move my back down, I'm gapping the joint and coming back up. You should feel that kind of at the back of your bottom. Beautiful. I'll show you the other way, how it looks. So left leg pops on top. Here is my SI joint. I'm going to lean over a little bit and then hands come here. I'm going to lean down, 2, 3 and back up. We'll do a couple more of these and then we'll finish on one more exercise. Trying to get that breath involved again. Breathe out as you slide, in as you come up. Beautiful. One more for luck. Perfect. And finally, we're going to use our chair. It's the back of our chair. You're going to step back and then just lean forward a little bit. So in this position, we're going to take one of our legs, come back, 2, 3, forward. It's again more of a glide. So back. I'll speed it up a bit. Good. This is really important. This is another one of those movements that we don't do a lot of in the day because we're sat a lot. This is wonderful. This is really extending and again gliding our SI joint. And we'll swap sides. I'll just show you in a little different angle. If you really want to feel it, take your hand, touch that area. There you go, and feel that movement. We're finished in 3, 2, 1. Very well done. So today a little bit different, more standing, more of our SI joint area as our primary focus. As you'll get to know me, and as everybody knows me, including my wife, I talk too much. Apologies. And we will run over the 7 minutes because I'm getting into it and chatting away. So that's great because we do more movement. So the key thing today, from the SI joint movements, that's probably where most of us are going to have a little bit of inflammation. Take some of the things that feel good and apply them to your day. My challenge to you today, when you're at your desk and you're going to go and get a coffee, just do 1 or 2 of those movements. Let's see if you can make a difference in the day, not just at the start of the day. Very well done. Let's catch you tomorrow. Have a good one.